anything that is emotionally authentic can be really beautiful because of the nature of the expression and getting to that point. But I'm not looking for something to be good or pretty or right. It's much more about how are you emotionally connected to that particular exploration.
Welcome to The Third Story. I'm Leo Sidran. You are listening to a podcast, and that was music psychotherapist Brian Harris on the beauty of emotional authenticity. As you may know, this is a podcast that generally looks at the individual careers and journeys of creative people. But the great thing about a podcast is that it can be anything you want it to be, and it can go in any number of directions. Recently, I've been interested in exploring ideas of community. I find that in my private conversations with friends in New York, over and over the subject turns to how isolated we can feel, even within the context of a creative life. So, to a degree, this podcast is designed as a kind of antidote to that feeling of isolation. So what does that mean for today's show? Well, basically in my neighborhood, in my small corner of the world, in my immediate surroundings, I noticed that I knew a few music therapists. It kind of kept coming up. And the more I thought about it, the more I realized that I didn't know anything about it. I didn't really know what music therapy meant or how it worked. So I invited a couple of friends, Brian Harris and Michelle Chestnut, over to talk about it. We met pretty late one winter evening. Brian was coming straight from a long day of work. Michelle was 8.5 months pregnant. She delivered a baby boy 2 weeks later. And I had a cold. Normally, I set the stage for these conversations with some music, and I break into the episodes from time to time to move things along. But today, I'm just going to let it run. So let me take care of the business of ensnaring you now. Visit third-story.com to subscribe to the podcast on iTunes or Stitcher, join the mailing list, leave a review, contact me, and see and hear all of the previous episodes. You'll also find social media links to my Facebook, Twitter, YouTube, SoundCloud, and Instagram pages. And now, without further ado, my conversation with music therapists Brian Harris and Michelle Chestnut, in which we answer the question, what is music therapy? As you both know, I have very little prepared to talk about other than my curiosity about music therapy. And it just seemed like I kept finding people in my community, in my circle of life, who are music therapists. Brian, we go back. I've known you for a long time.
Yeah.
Michelle, I met you as a parent.
Mm-hmm.
So I really just wanted to get together and kind of have a conversation about what music therapy is. The concept is somewhat foreign to me, and I have my own relationship with music, and I sort of have an understanding of how I think about making music and what I think about the community of musicians and the way that I use music to communicate with people. What is our common understanding of music therapy?
We have an organization, a national organization called the American Music Therapy Association. And as the professional body in this country, the AMTA has, its own statement on behalf of the profession about what music therapy is. And of course, we can find that easily on musictherapy.org. So that's there.
And what does the statement say, more or less?
Music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program.
We are probably more representative specifically of music psychotherapy because music therapy can be practiced in a lot of different ways. It is sometimes considered a bridge profession, meaning there is the music aspect and there's the therapy aspect of it. And the music aspect can be paired up with various different kinds of therapy. So you can use music to work on gait and motor functioning. You can use music to work on speech development, music to work on cognition, lots of different areas. And so sometimes music therapists and music therapy as a profession will appear to be more aligned with, for example, the goals of speech pathologists or occupational therapists or physical therapists. The way that, I think I can speak for you too, that the way that I think Michelle and I practice is more aligned with psychotherapy. And so, I define myself as a music psychotherapist because And I make that distinction when I'm telling people what kind of work I do, because it is specifically aligned with those kinds of goals.
In what way does music help people get to speech, to access a part of their brain or their expression in a way that language doesn't? What happens with music that allows people to communicate in a way that they wouldn't be able to through words?
Music is really fascinating in terms of how it functions. Like, if we take the example of Alzheimer's and dementia, with the declines that you see along with Alzheimer's and dementia, we normally think about the progression of the disease normally lends us to thinking about loss and the things that we lose. But there's some interesting positive things that happen where you have a decrease in inhibitions, and that decrease in inhibitions also allows for a greater creative capacity. So you get folks who have access to creativity that they not only didn't have before, but maybe couldn't have had before due to inhibitions. And when that happens, you can start to build a new system of language and communication around what's happening for them. So for example, whereas sometimes we might look at somebody with Alzheimer's and think of their tapping on a table as being a negative behavior. As a music therapist, we might look at that as being a form of communication. What are they trying to express with that, and how could we incorporate that into a system of musical and creative language that helps develop that relationship? Mm-hmm.
If you were to say to me, we're going to have a jam session, I would immediately have an assumption about how that was going to work. If you said we're going to get together and we're going to play songs, I would have an understanding about how that works. If you asked 3 musicians that I know asked me to come over to rehearse, I would have an assumption about what that. There's just certain kind of baseline understanding that I have about how that works. What I don't have any understanding of is like, what is the work exactly? When you're working with a client, what is the work, and how does music function in the room?
And I think that probably varies even between me and Michelle. You know, we could both have assessment sessions with the same client, and we would do it differently. One of the things, there are certain things that I tend toward. So I'm in private practice, and so the folks who I work with are generally self-referring adult clients who are coming to me for some kind of psychotherapeutic need. And so if somebody comes to me for the first time and they come into my office, which has a bunch of instruments around and is a soundproof space, when they first come in and I don't know anything about them yet, often what I'll do is just ask them to share a song with me that they've been feeling connected to. If they are themselves a musician, they may choose to play that song or sing that song. If not, they may just pull it up on their phone, or I might pull it up through Spotify, and we will just listen to that song together, or I will listen to the song if they're creating the song. That, to me, is the music therapist's way of, or a music therapist's way of asking the question, what brings you into my office? Because that song itself will hold so much important information about why that person is there. Any song that we are listening to or feel drawn to on a regular basis holds a ton of information about where we are. More often than not, we, myself included, don't really stop to listen carefully and closely to that song. Sometimes it's the music, often it's the lyrics, if there are lyrics, or both. And by just honoring that space and listening to it together, inevitably there will be a ton of useful information that will come up that will tell me about where that person is. But maybe even more importantly, it's such an intimate and personal piece to share immediately, but because it has the containment of the song, I think it can feel safe enough to share that piece of intimacy.
In some ways it's interesting if somebody performs for you, but I'm actually very drawn to the idea that just listening to music together is an act of communication. Just listening to music together is an extremely intimate thing to do, right? But the fact that this is also therapy, it makes me rethink all of the communal listening that I've done in my life with people.
Well, and if you think about, I'm old enough that I'm of the era of mixtapes, and you think about what intimate creations those were. Like when you created a mixtape for somebody else, there was something you really wanted to communicate through those songs. Sometimes it was obvious to you what you wanted to communicate if you were sharing it with a crush and you were giving them a lot of songs about love. Sometimes it was friendship and you just really wanted them to understand what you were experiencing. And those songs that you put together held a great deal of meaning, and the act of listening to it by the other person was an act of really sharing that emotional space as well.
Michelle, how does what Brian describes compare to the way you approach a first session with somebody?
When I am seeing somebody for the first session, I ask them, what's bringing you here? Which is traditional talk therapy. The musical piece, which may or may not happen in the first session, it depends on the person. It may be listening to music when people are feeling strong enough and there are issues from the past or some major block. That's where I'll incorporate vocal psychotherapy, which is a method and technique that Brian and I both share, that we trained in together.
Yeah.
And what is it?
So this is a method and technique that centers around the voice and singing. And there are a few aspects of it, but the gist of it is it's a very intimate experience of the therapist and the client working together. The main point of it, generally speaking, is to have a very intimate experience, for the voice to be free, for there to be, like a free association, just kind of talking off the top of your head, but in song. It could be with lyrics, it could be without lyrics. It could be just kind of vocalizing without words necessarily. So there's a free association so that feelings and thoughts come out. They can come out quickly. Deep stuff can be accessed and come out quickly in the safety and containment of the musical experience. And the musical experience the therapist is providing and containing, which is just a 2-chord structure, pretty simple 2-chord structure, back and forth, and then free associating over that. And the therapist there's some particular techniques that we use, some of which come from psychodrama, which is another area of the creative arts and psychotherapy, where we mirror what the client is doing, we reflect to them what they're doing, and then sometimes we add words that we think that they might be saying, which can be very touching.
That they might be saying, like you might be hearing them in the sounds that they're making, or that they're trying to say. How do you intuit what they might be saying?
Well, I might think, I wonder if they're really trying to say this. Either they don't know the words to use, they're afraid to. So I might say it.
Generally, by the time you've put that word in the air, are you pretty confident that that's the word that they're trying to say, or is it's possible that that might not be the word that they're?
It's possible. I might be wrong, and I talk with the client before we do it, saying, "Look, here's what you're going to do. This, you're going to sing, and I'm going to sing too, and eventually I'm going to insert some phrases. If you disagree with what I say, then just forget it. If it really resonates with you, then you can sing it too. If you resonate with some of it, then you can sing some of it or change it into how it does apply to you." So we kind of have a contract of what might happen before going into it. And, they usually agree to that. But sometimes what I'm guessing that they're saying, if they decide not to sing what I'm singing, that could be for any number of reasons too. That could be that I'm just wrong and off, number one. It could be that they're not ready to say it, or, they're not ready to face that thing that I'm proposing. It could be that maybe they don't understand it yet. I might be using some language that, by the nature of them coming into therapy, sometimes for the first time, they kind of don't know what I'm saying yet. So they can't agree with it. Or maybe they're in denial still. Like whatever we're doing maybe that was the introduction of the awareness. So the musical experience happens and then it's over, and then we talk about it. What it was like for them to be in it. What was it like for us to sit so closely together and to sing together?
What is it like for you to sit so closely with so many people and sing together with so many people? This is an extremely intimate position to put yourself in over and over and over again with different people.
Yeah, it is. I think one of the powerful parts about like the techniques Michelle was describing, when you are co-creating, it's interesting because that doesn't happen so much in traditional verbal psychotherapy. You co-create sort of one at a time, but you don't really do it together. And the interesting thing about music is that you can both be expressing at the same time, and yet you're not ignoring each other by expressing at the same time. You know, there's something about that intimacy that's really appealing. It's both the aesthetic component of it, but it's also that the client has an opportunity to be exploring an expression, but we can be there with an expression that we're bringing as well that can mean that they feel supported or contained or driven or whatever our function may be while we are co-creating, as opposed to if you're talking at the same time, it basically just means you're not listening. So I find that really interesting in terms of the kind of intimacy that you develop in a therapeutic relationship and how it may be different with music, because you can both be expressing at the same time.
And yet what you're expressing is really designed to facilitate somebody else's breakthrough or somebody else's realization.
But there's something, it is, absolutely. I mean, my job is to be in support of the other person, of my client's therapeutic experience. It's not about me. And yet, this I find true of music psychotherapy. I think it's inherently a more intersubjective field, meaning that as therapists, we bring ourselves and our emotional worlds into it more than we might if we were just doing verbal psychotherapy, because you can't really create music without bringing yourself into it. And so I think it becomes this piece where, particularly in the music, you can be a little more distanced, and I think I probably am a little more distanced in the verbal components of psychotherapy. But when it comes to co-creation of music, you are always bringing yourself into that space. And I think that's interesting.
I think it's at the heart of making music. And I find it actually is one of the common threads between what I do to make a living and what you do to make a living.
Yeah.
You know, I write music as a service. In my case, it's generally for very commercial outlets, like writing music for TV commercials or for TV. But I'm essentially being hired to do a specific thing, and I'm given a very specific task. And a lot of times, like, it's very laid out what's being asked of me. And at the same time, there's no way for me to do that passively. I have to bring my aesthetic, my criteria, myself. You can't express without bringing yourself.
Your emotional world on some level.
Even when it is as a service or in the context of providing a service, you still have to bring your emotional self. Yeah. I think that's where probably the two extremes kind of meet, you know, because I think of what I do as being very different from what you're describing, and yet there are some very, very strong similarities as I hear you talk about it. And one of them is like in particularly the fact that there's you have a client relationship with somebody.
Right.
You are there to help somebody else realize something. And yet, and this is the piece of it that's so interesting to me, it's happening through music, and regardless of whether or not you're making professional music, do you want it to be beautiful? Should it be beautiful?
That's a great question.
It is a great question.
What a great question. Should it be beautiful? Yes and no. I mean, yes, in that, you know, in a existential, really big way.
Right.
Yeah.
It already is.
Yeah.
No, in that it doesn't have to sound good by whatever conventional standard a listener has for beauty. Sometimes my clients, when I offer some music experience to them, would say, no, I can't. I've never played anything. We're going to sound terrible. Mm-hmm. So part of the work is talking about that expectation of sounding bad and then talking about what it might be like to be judged, you know, the expectation of being judged. And so it can be useful to talk about that with the client about, you know, expecting the not sound beautiful.
Yeah, I have a strong reaction to beauty, and you and I have probably been involved in discussions about this before too. To me, I agree. Like on an existential level, like
it is beautiful.
Like to me, the screeching and wailing, anything that is emotionally authentic, can be really beautiful to me because of the nature of the expression and getting to that point. It doesn't mean that, you know, the pitch is there, or that the tonality is right, or that the rhythm is even, or any of the components that we might traditionally look at to evaluate whether music is good or pretty. I'm not particularly interested in those pieces unless they're to sort of assess. But I'm not looking for something to be good or pretty or right. It's much more about how are you emotionally connected to that particular exploration.
Michelle, I know you talk about having people draw or do something visual as well. Do you find that people are more open or less timid visually than they are musically, or how are they different?
Yeah, my clients, they vary, and sometimes I don't know. Some of my clients are musicians or music therapists or other artists, non-music artists. I can never totally guess who's going to be up for what, including people who come to me because they may have some stage fright or performance anxiety, and they want to work through these things. And
so that could be a patient, somebody who's trying to get over a certain amount of stage fright or anxiety about performance.
Yeah, I've had referrals from coaches or teachers of adults, and their anxiety is encroaches on the educational experience, so they need some extra help emotionally or mentally to work out the more intense kind of stage fright. I mean, a lot of people get nervous before going on, but
it's interesting to me the idea that you could even have musicians or performers who would turn to music therapy as a way through their anxiety in music.
I find that a lot of times clients who, the more sort of canonized and classical their training is in a particular art form, the more complex their relationship is to that art form. So when I'm working with musicians, they often have much more complicated relationships to music than people clients of mine who don't have a musical background.
Sure.
There's a lot more emotional stuff that's wrapped up in the experience and the exploration of music itself.
So how does that affect the way you work with them?
It makes it more complicated in the way that we're looking at music. Their relationship toward music can be then more complicated. It brings in a lot of interesting dynamics. For example, someone who is very musically adept may be able to hide what they're actually feeling through their musical abilities. The same way that someone who's very articulate can mask what they're feeling by sort of talking around it. A really skilled musician can present music that sort of has an air of emotionality but not really be an authentic expression.
Personally, how does your relationship with music change as a result of doing this work? Did you come to this work because you liked or loved music, or because it seemed to make sense from a therapeutic point of view? I mean, how do you marry these two things?
Leo, I think this is for me, it's such an important question. For me personally, I mean, it has been in my mind since I started studying music therapy, because I came from having studied music very seriously. I played viola growing up. I remember my mom tells me about me being 4 and 5 years old and, playing on the toy piano, the theme songs to TV shows, and flying through playing the viola, just having a natural gift for it and for music and music theory. And I went to a special music school from 5th grade to 12th grade and then entered a music conservatory for college. By the time I got there, I had been so focused on music that I thought, I want to know what else is out there. I had never elected a class ever. And I thought, people elect classes, they get to choose something to study. And I was so curious about that. So that's when I left music conservatory full time and went to a liberal arts college. Although I did continue studying viola and chamber music at the music conservatory, and took a couple years off after school. Experimented in music teaching and lessons and gigging and some administration in music, and none of those hats fit. And this is where the juicier part comes in for me, which is that throughout my life since I started playing, which was probably about 8 years old when I started playing viola, I was just so naturally good at it and received a lot of what seemed like unconditional love and opportunities. Changed my life being a part
because
of
you were
music.
good at it.
Yeah. I was in orchestras. I moved socioeconomic classes because of it. It's kind of interesting in a way with this, the election and the way things have happened and what we're seeing, what's being revealed in our country. But, here I am. I live in Park Slope, but I come from blue collar background. So music, I would say, is the thing the thing that was the vehicle.
It was a mode of transportation. It was a way of traveling.
It moved me. Not only that, but it became my identity. It's wonderful to identify with something that happens so naturally and that sounds good and gives you opportunity and brings more and more people in and attention. And for me, that got interrupted toward the end of high school. And there was, because of some of the things I mentioned earlier, losses, and my viola teacher died very suddenly, and there were a series of things that affected my sense of security with music and the relationship I had with music. The experience over the next few years was that it had been this thing that I was able to hold. And now all of a sudden it was slipping through my fingers and it was just going away the way that I had known it. Yeah, it was still so important, and I didn't know how or that I could just say, okay, that happened, moving on. Maybe I'm going to be an engineer now. That still, I wasn't there yet. So it seemed, I felt compelled to still have music be important in my life. So when I learned about music therapy, I thought, oh, there's a way that I can play music and be musical with people and help them. That sounds great. And that is. But the underlying thing was that my relationship with music at that point was rough. And I didn't know what had happened, and I also didn't know what was happening because there was still this rift happening. So really, I entered music therapy because my relationship with music needed therapy.
Yeah, it sounds like you were like your first client.
Yeah.
Brian, you never considered a career as a professional musician. That wasn't part of your trajectory.
I really never did. I loved music from a really young age. I was looking back at photos from me when I was a little kid. I was probably 3 years old, and I was my uncle and aunt met at Indiana University music school, and so there's a picture of me sitting on my aunt's lap looking over at my uncle playing guitar, and I'm just transfixed by the music. And I remember being transfixed by music from the time I was very little. And I, played flute, and I sang, and I, was actively involved in music throughout my upbringing. It was a powerful form of expression for me. But I don't think I ever really thought about being a performer. I think it didn't have that much appeal to me. And I kind of always knew I wanted to do something that was in a helping profession. So when I was 18 and I started college, I started in music therapy.
My memory of meeting you, and I think that you maybe would remind me that we met once or twice before this, but my sort of first real memory of having a conversation with you is now we're going on almost 15 years ago, 13 years ago maybe, where you had just come back to the States and you had been working abroad. And, you and I are about the same age, so this was like very early on in your career. It was like an early part of your development.
Yeah, the work I did in Bosnia.
Yeah, how did that come to pass so early in your life?
Well, actually, I appreciate that you're putting us at the same age.
Yeah. Are you a lot older than me? I don't think so.
I'm enough older than you that I had
old.
been in the field for 6 years.
Yeah.
I practiced for 6 years in Madison, and then I moved to Bosnia, where I worked as the head of the music therapy department at the Pavarotti Music Center, and we worked with children who had trauma from the war. That was a gig I got actually off of the American Music Therapy Association website back when, the World Wide Web was still a little bit mysterious to me. I had been working in Madison, and I had a contract that was just ending due to county funding, and so I was thinking about my next steps. And I'd applied to a doctorate in psychology program and gotten accepted. And then I saw this application for the job in Bosnia on the website, and I thought, that's insane. I can't imagine who would possibly go live in Bosnia. And by the end of the day, I was sending out my resume. And I interviewed over the phone for an hour and a half, and I was offered the job. And I'd never done that kind of work before. I had been involved in Amnesty International, and had traveled a lot, and had been very interested in those kinds of projects before, but hadn't actually done the work. So yeah, I was pretty green when I headed into it.
What kinds of patients or clients said you've been seeing in Madison, and
how did it translate?
How did it translate?
Yeah,
we talk about this as getting to something super verbal or beyond the ability to communicate with words, but obviously it's very different to walk into a room with somebody that doesn't speak your language at all.
Yeah.
And do the same work.
That's a great question. It was, so the work that I'd been doing in Madison, so my internship was at a place called the Central Wisconsin Center for the Developmentally Disabled. Out of that, I started working in long-term care facilities. I worked at Meriter and Badger Prairie in Madison, and they were both long-term care facilities. One of them was a county facility, so it had a locked psych unit and a locked Alzheimer's unit, and then several sort of like long-term care, more geriatric units. So it was a combination of psychiatric and work with Alzheimer's and work with long-term care. It was very different from working with children with trauma from the war in the former Yugoslavia. There were a lot of things that carried over, just in terms of having spent 6 years learning how music could be used as a tool of communication, and how to learn someone else's musical language. That was still very much a part of my work. But, then of course, going into another culture, and this is something we were touching on earlier too, at the moment I'm preparing, in 2 weeks I'm going to Jordan to work on a project where we're going to try and set up music therapy in the refugee camps there. And so I'm thinking back to a lot of questions that I learned from my time in Bosnia. Among them, how do the folks there culturally relate to music, but also how do they think of themselves as individuals, or in terms of a more collectivist identity, and based on that, how do you approach therapeutic work with them?
Do you work with groups generally here? Does music psychotherapy generally happen one-on-one, or does it happen in a group setting?
It can happen in a group setting, and I've done a lot of group work. The work in Jordan will probably be predominantly group work. The work that I do now, my own clinical work, is predominantly individual work. Mm-hmm.
There's the group therapy aspect, and then there's also the therapeutic group setting, which is a little different. So if you have a therapeutic group, for example, one of my specialties is prenatal and postpartum moms and partners. So I've offered groups, and those are not therapy groups. They're not group therapy, but they're wellness groups. Uh-huh. And I do offer therapeutic experiences in music in them. So, and what's that? For pregnant or postpartum moms in particular, but also partners, where it can be a very scary time, a raw time. One's basic needs are not met necessarily because of taking care of a newborn. You've slept 2 hours a night for the past 2 months, So, drudging up anything is probably not very helpful. So what's helpful is feeling better. So the therapeutic experiences that I offer there might be singing songs that they identify in some way as uplifting, chanting together, music for relaxation and meditation. I'm remembering one experience in one of these groups where the babies are there, and it's kind of like real life. Okay, mom or partner is there trying to get some self-care, and the baby's there, and oops, now the baby's crying. What do you do? So part of that work, I would kind of coach them through the moment. Mm-hmm. Okay, so now's the time to feel how your body's feeling with your baby crying in front of you while you're trying to take care of yourself. Okay, how are you breathing? What's the rhythm of your breath right now? How fast or slow, how deep or shallow are you breathing? Looking at that rhythm and helping them to exhale and maybe to vocalize. I might say, okay, just let out any sound right now. And then to bond, to use it as an opportunity potentially to still connect with their baby, even though sometimes you feel like, like I just want my own care right now. So to help them to then say, okay, see if you can now vocalize and match your baby so that you can still be that present, that consistent presence, that parent that can reflect to the baby, which is what the baby needs for secure attachment anyway. Mm-hmm. So that's therapeutic. So that's some of the work that I've done in these groups with particular, it's a particular population, particular time of life.
You know what I find so interesting about that is I feel like in some ways it wraps back around to the discussion of like, how are you present as a therapist in it, or how do you do the work that you do, like sort of fulfilling somebody else's need but bringing yourself to it? Like, what's the negotiation of how you bring yourself into trying to meet somebody else's needs?
Yeah, and I'm sure we've all been there where, especially for me early on, okay, I studied music therapy, I'm a music therapist, it's got to look a certain way.
What do you mean?
We have to do, the whole session should be music.
Right.
Or there should be this should look some certain way to qualify as music therapy, but that's not always fulfilling the needs of the client. So meeting them where they are, and sometimes having that broader approach to the elements of music, like rhythm, where there is rhythm.
Well, no, I hear you saying that there's rhythm in breath, that there's melody in a very simple vocalization, that the essential building blocks of music are happening at all times. It actually raised a question for me about just the power of the voice. I mean, I guess I've always had this kind of vision of a room filled with instruments, and that you could sort of put a drum in front of somebody, put a stringed instrument in front of somebody, kind of allow them to explore it, and even with not being familiar, somehow discover something about themselves. But again and again, it does seem to come back to the voice, that there's something about the human voice that's kind of the most immediately connective, that we can immediately, right now, we could make music just by singing together, that it's the most universal thing that we all have. Do you find that more often than not it comes down to the voice?
I think vulnerability is such an important piece of it. The voice is the most intimate instrument that we have access to because it comes from inside of us. And I think one of the questions that it raises is a question of distancing, which is a concept that the drama therapists are really great at talking about. We as music therapists are not as good at talking about it, but I think it serves us really well to talk about that in terms of how does the client relate to the music. So an example of more distanced might be, for example, listening to music that has been created by somebody else. And then there are gradual levels of decreasing the distance that you have in relation to that music. So playing a drum with a mallet that's in front of me might be one, and maybe being more physically involved in the process. Playing a drum with my hands might be less distanced because my body is involved in that process of the creation of the music, and then moving all the way to the creation of sound with your body and your voice. There is less distance in that, and so that the lack of distance is also about increase in intimacy and increase in vulnerability.
That's a really great point. I mean, how is progress measured in music therapeutic terms? And I can imagine that one way of measuring it would be in that progression from distance to proximity to what you're doing. I mean, how do you evaluate that?
So I could tell you a vignette from a session today, which will be entirely confidential other than just some pieces around the emotionality of it. It was a client I was working with who brought in some words that she wrote down before the session, and we took them and just some ideas. We took them and took a look at them, and it was one of the first times that she was really able to access anger inside the session, and somebody I've been working with for over a year. And we took that and moved it actually into vocal psychotherapy, and we did some free associative singing with it. And she was able to musically access the expressions of anger too. And that was new and powerful and important. It was a really important piece in her journey. So that was, that sort of translated both from the general emotional sense, but also what she was able to explore in terms of the music ended up being very important. And, that's something I wanted to say, if I can, about what I think is so cool about, for example, vocal psychotherapy techniques. You can go into an exploration of something, as an example, anger. Let's say that I'm singing about being angry at my mother. just to
Just
go straight
say
for
something, yeah.
right. And if you and I were sitting as client and therapist, and let's say I'm the client in this example, and I say to you, I'm angry at my mother, and you say, I hear that, you're angry at your mother, and it sort of stops there. We might explore like what the roots of it are or like other pieces behind it, but we don't really necessarily stay in that expression. The cool thing about the aesthetics of music and the structure of music are that you can stay with that idea of anger aesthetically and emotionally in a way that makes sense within the context of music.
You can express something that sounds angry, that
you can
feels
express
angry.
something that sounds angry. You can increase the volume. You can change the dynamics of it. You can bring in more dissonances. We can repeat it. We can sing it together. We can change our vocal qualities to really be matching that, and we can repeat over and over again about like how angry I am in a way that can really sort of make sense. And that allows the deepening of that experience, where we really sit in an embodied space of that emotion, as opposed to an intellectualization of the emotion that's like, oh, okay,
Right.
I think that I feel angry. Like I really get to be inside that expression.
As a sort of side note, just a question I've had about therapy from the point of view of the therapist, I guess, and I think this speaks to it, is like, you may have recognized early on that there's something that you're trying to get to, and patiently you're waiting, you're helping to bring your client to be able to name that, to own that, to say that, to live in it. I imagine that requires an enormous amount of skill to decide when to push, when to put the word in the room, when to wait.
And we're not always right, and sometimes even that can be an important part of the modeling. Philosophically, I think of therapy as a collaborative effort. We are working together to unpack what's going on for my clients. It's not about me having all the answers and just waiting for them to get to that point of having the answers. Often, I may have a sense of things, or I might have a direction, or there may be things that I see, but I'm also learning as we go. And I think often things will emerge in the room and they will make sense to both of us as they're emerging. I may be, a thought or two, an emotion or two ahead, or I may see some things that I'm sort of holding for the client as we go. But it's less of I don't envision myself as the person who kind of just sits and withholds the answers and waits for my client to be able to get them. I think of it as more of, we are collaborating to see what's unfolding and to help learn more.
And maybe that speaks also to the way music works. It does force you to be present. Michelle, you described this idea of being present and checking into the present, and even something as simple as looking at your breath or a simple meditation. But because as I explore a little more deeply meditation, I understand that actually playing music is a form of meditation. And particularly when you're playing together, you're exercising a kind of collective entrainment, a kind of collective meditation. That when we choose a rhythm and we play it together, that we are doing something, we're meditating collectively. So I think that there is something that happens in music that has to happen in the present that maybe doesn't happen even in a conversation like this. In music, it's constantly being reinforced.
To speak more toward that, the skill of the therapist.
Yeah.
That is why in that definition from the American Music Therapy Association, there's this little phrase of, by a skilled professional.
Interesting.
Music therapist. This is where our skill and experience comes into play, and I find it a really exciting time in exploring that. I mean, it is, the co-creation of the relationship. In my work, whether it's the music or without the music or in some other medium.
Yeah.
I think a lot of us do this naturally, and we're taught it to kind of be one foot in their shoe and one foot in our own shoe.
Yeah.
So we're going in together, and I feel that, and I don't know what's coming. Even if I think I have a clue or a hunch about certain things, each person's experience and manifestation of whatever it is that they've experienced is different. Even if we have we could say, oh yeah, I grew up with this too, and I grew up with that too. But the manifestation, the expression of those things can be very different. Even if I have a hunch, I don't really know what I'm walking into. So it's walking into like this new place.
Every time.
Looking around and listening and asking questions.
Yeah. And I think also, one of the things in my doctoral research, I was looking at specifically at how creative arts therapists use embodied interventions with trauma. But one of the themes that emerged was that, these instincts that Michelle are talking about, like, oh, I have a hunch about this. Those have to be trained and informed. And that's part of, our work as therapists. And a lot of that is really done through, this was one of the themes, that it's through our own therapy and our own supervision.
Yeah, that's what I'm hearing over and over here, is that you are able and encouraged to do your own work as well.
Absolutely, because I have to know who I am in that session space. I have to be able to differentiate. There's something emergent for me as a feeling, and that is because of my own stuff, or, maybe that's because of what's happening in this space.
Yeah.
I have to be familiar enough with my own responses to things, my own emotional world, to be able to make those informed distinctions and help my client better understand their emotional world without putting my stuff onto them.
Yeah, right on. Right on that we're the instrument.
Yeah.
We resonate. We're like the sounding board in a way. And I think one of the special things about being a music therapist or a creative arts therapist, maybe in general, is that I think it's really important to know ourselves and to know ourselves in that medium. So to know myself generally and to know myself as a musician, or to know myself in relation to music. Because I could, like Brian was saying, basically, I could inadvertently be putting my own musical thing on somebody.
Yeah,
totally.
Rather than me really listening to them or facilitating their musical expression.
You need to be able to lead when it's important to lead, and to follow when it's important to follow. But that's a delicate balance too. It's funny, I hadn't thought about that. Like, you are making music together. You have a criteria, as you said before. You have to bring something to it.
And I think there's a piece of that I think you would find interesting, Leo, which is, this comes back to, or comes to the question of what relationship do we have to music outside of our work?
Yes, this is what I'm really wondering.
I guess it challenges me to think also a little bit more about my own musicianship, not just as a therapist, because if I am unfulfilled in my own musicality, there's a greater chance that I'm going to try and play that out inside my work. And so I really kind of have an ethical responsibility also to be connecting to and paying attention to what are my musical needs. What do I need to be expressing and exploring? So I'm not trying to do that with my clients for my own benefit. And that gets to, do I want to be performing? Do I want to be having, collaborative musical experiences with friends, to be in a choir, to have vocal explorations together, or those kinds of things that may have nothing to do with my clinical work, just so that I have my own.
And have you found that? I know that you have sung in choirs and that we've played songs together. Yeah. And have you found that when that's not happening in your life, that you do have a musical need looking to work itself out in sessions?
I have found that it's important for me to listen to when I need to be exploring music myself. Yeah. And sometimes in between sessions, even if I have a break in between sessions, I may sit down and just play. I might, try and connect to music to listen to where I am. And that can actually have multiple functions. It can also be a means of kind of debriefing, in other words, like this is my story. I'm out of this session, so I'm no longer carrying your story. I need to reconnect with what mine is.
Like the life of a freelance musician, if you have private practice, you are also dealing with the economic and professional realities of bringing in work, deciding how much work to do, figuring out how you get paid, the instability of all of that. What is that setup like? How does it work? How does it resemble? You're married to a musician as well. Are they as similar as I think they are?
And I'm married to an artist.
That's right. That's exactly right.
I was able to say immediately, okay, yeah, I want to be in private practice. And then it took longer to realize, I'm a small business owner.
Yeah.
If I'm committing to running a private practice, then that means I'm a business person, which means I have to learn business. And that becomes a choice, because I think we probably know musicians and other artists who embrace that and who don't. And once I kind of realized that, I have to learn business. I have to learn business planning and marketing planning and networking. And some musicians that I know are just great at networking. It's just one of those natural skills that comes to them, not so much for me. So that's been part of my learning in having a private practice. The business entrepreneurial nuts and bolts, which I think for me at first seemed it's kind of, I don't know, maybe hard for me to reconcile that. It's a funny place to be in, to offer healthcare. So we're offering healthcare. That's what it is. As a psychotherapist, mental health care. I'm out of network with insurance, so people are paying me out of pocket.
How does that feel?
Now I'm largely okay with it, but I know, it's not my wish. I wish that as both a provider and a patient, of course, I go to all sorts of providers. My wish would be that it's just covered, that the person.
Does it change the dynamic? I mean, I go through this, and it's a slightly different example, but I have a much harder time collecting money for my production services, let's say, directly from an artist who's saved up their money and they wanted to go record something and they pay me. I feel much better feeling like somehow they've raised the money or somebody else has invested in them. I have a much harder time taking money directly from somebody. It makes me feel so responsible that sometimes I feel uncomfortable.
Yeah. I mean, I've definitely felt that. I mean, money is one of those funny things, and we have a relationship with money. We have a relationship with earning, and some of my clients come in with those issues, and sometimes it gets expressed through our financial interactions.
Yes.
Yeah.
So it can be an opportunity to work through that stuff together. Now, I might feel really uncomfortable sometimes. So one option, some therapists, I offer a sliding scale.
Yeah.
I do that for people for whom it's a hardship. And I don't check their income. I just trust them. I ask them what's sustainable. What is sustainable for you to come here on a regular basis to do this work? Go think about it and let me know. That's where I am right now, with this work. I want people to be able to show up regularly. And I'm transparent with them. I tell them that's for them, but it's for me. I can't not have this kind of conflict of interest. It's there. I'm the therapist and I'm the person collecting the money too.
Right, there's nobody else.
Yeah.
Brian, I see you nodding. Igor.
Yeah. I think there's also this complicated piece around when you do work that is in service of other people. There's sort of this old-fashioned, unspoken notion that you're not supposed to care about the money.
Yes.
And the reality is that I love my work, and this is also my livelihood. It's my business. It's important for me to make an income that can sustain my life. And so those two pieces go hand in hand, and I don't see them as conflicting. I find it lingering in the music therapy world. There's this feeling of like, well, this is really, noble work, therefore the money shouldn't matter. And I think that's a little insulting. It's like I can both feel like this is something I'm really drawn to. I can feel like I really want to work collaboratively and hopefully in helping people, and I want to make a living out of it.
It gets particularly complex when you talk about the fact that this particular issue can get worked out through therapy.
And it often does.
Right.
I think music, that's interesting.
Yeah.
Money often enters as a piece in therapy. It can enter as part of sort of resistance to coming in. It can enter in terms of pieces around independence or dependence, feelings of self-worth or feelings of worth of the particular service. But in general, often it will wrap back around to something that's going on for the client. And you can take a look at money in that way. And it can be really important, although it's challenging. Money is a hard piece to talk about.
Yeah.
And it's a hard piece to talk about in therapy, but I find that it's something that kind of has to be confronted, particularly when you're feeling like it's something like, oh, I'm not sure if I want to talk about this. That to me always says, okay, this is something that needs to be brought to the surface because it's holding something.
Yeah. Yeah. And the helping professions. There's so much, particularly the helping professions, I think, that have been dominated by women.
Yeah.
There's so much of, I shouldn't care about the money, or don't worry about it, or of course being underpaid. And I've definitely have subscribed to that. My process with literally reconciling that is realizing all that I've put into this. I mean, I have invested a lot.
Right.
I have invested so much of my time and energy and money into becoming this professional and providing this professional service.
Yeah.
Letting myself value all that, which means consciously taking an inventory of what is it that I do? What do I know? What do I do? What do I offer? What happens? And that ties in with the business work too.
Yeah.
'Cause you have to be able to say that kind of stuff. But
but it sounds like it's a little bit, it's also, there's a secondary layer of that, which is not just the business being able to say to people, this is what I do, but to be able to remind yourself, this is what I do. This is what I'm charging money for. This is why it's acceptable for me to charge this money and why it's necessary for me to do it.
yeah.
And I think it can be hard when you first go into private practice because you're not used to having to negotiate those things for yourself as much. The salary is more of a, if you're working for a hospital, for example, it's a one-time thing that you negotiate, or maybe once annually. You talk about those things, not a regular thing. And it's a different relationship. I wanted to say something on the question that you asked about, like setting up private practice.
Yeah.
One of the challenges that I found was boundaries. I thought that I would be a really good boss to myself, and I wasn't. I wouldn't give myself vacations. I would work too long. I would, really just I'd be working every day. And I've really had to learn to set boundaries around what work means for me. Because I think, and this isn't just, I imagine this is true for all of us in the room on some level, but when you work for yourself, you have to be able to set some functional parameters, some functional boundaries around what work is and what isn't work. When am I not working, and when do I let myself take time off, and when is it more important that I have a day or a weekend or a week with my husband than that I make more money?
I would love to continue to explore that conversation with you because I don't have an answer for that. I mean, I think you're right. Most self-employed people don't have an easy answer with it.
I think it's ongoing.
Yeah.
I don't claim to be perfect at that at all, but I'm more actively engaged in that discussion with myself.
Especially when you like your work or when you love your work, when it's the thing that is exciting to you, it's the thing that you do want to be doing. It's also much harder to set those limits. I just want to wrap up by asking the question that I was wondering before we sat down, which is when we make music, when we all make music, when we sing together, when we play together, are we engaging in a form of music therapy? Independent of the definition that we read from the website, is making music by definition a form of therapy? Or do we want to call these things two separate things?
One of our former professors used to say, in order for there to be music therapy, you have to have a therapist. So music can play a therapeutic role in a lot of different scenarios, but it doesn't necessarily mean that it's music therapy happening at the time. And I guess I would say that music can have all kinds of different functions. I would say that often it would play a therapeutic role in different kinds of contexts, but I think it can play, as many roles as expression allows for.
It's an important question because we know as musicians that you have these experiences that you feel in your blood, your muscles, you feel it in your bones. Like there's some special, almost magical thing happening in that moment. So, isn't that, maybe that's therapy.
Yeah.
Maybe you feel great coming out of it, and I think that can be therapeutic.
Yes, but it is not music therapy.
Not therapy,
Yeah.
for all the reasons that Brian just gave. it can be therapeutic. It can be something that in which we're transported. We might transcend some, like our physical boundaries while we're making music. Like I'll never forget when I was in high school, I got a chance to play in the Philadelphia Orchestra, one of the great orchestras in our country. And I'm from Philadelphia, so I'm a little biased. But and as a string player, they were known for their string section for so long. So lush. And so I got to play literally in the middle of the orchestra, and I'll never forget that sensation, not just the sound, but just the sensation, this incredible lush wave. It really was like a wave just coming over me.
Yeah.
And I know other string players in particular who had that same kind of experience when they entered into, maybe the next level, or that was the Philly Orchestra, so many levels ahead. It's almost otherworldly. It's nothing like you've experienced before. But it wasn't
it's not therapy.
And also, experience in music it's not necessarily always good.
Totally.
I came into music therapy, like I said, because I needed it for my relationship with music, because it had gone so quickly from being so good to being so bad, and sometimes experiencing traumas from it because it was so out of control. So it's not in and of its, I know personally that in and of itself, it is not therapeutic.
Yes. Well, it's very clear that we are all passionate about this question, both of you in particular, because it is 11:30 p.m. Michelle Chestnut, you are 8.5 months pregnant. Brian Harris, you came from a full day of work yourself.
Yeah.
Thank you so much for spending this time with me and enlightening me.
Thanks, Leo.
Thanks so much.
There it was, my talk with Brian Harris and Michelle Chestnut. Music psychotherapy, what it is, what it was. Third-story.com is your place to go for previous episodes like the one with neuroscientist and writer Daniel Levitin. I'll be back next week with another great conversation. Until then, I'll talk to you soon.